These scenes have been all over the news. Desperate people stampeding aid distribution sites, shots fired into crowds, children wasting away. This week, a UN-backed agency said that the worst-case scenario of famine was now unfolding in Gaza. Israel has faced increasing condemnation for the situation there. Britain's Keir Starmer says the suffering and starvation unfolding in Gaza is unspeakable and indefensible. And even Donald Trump expressed concern this week, saying there was real starvation there. In response to the outcry, Israel announced daily pauses in fighting in parts of Gaza to distribute aid. What has led to this rapid deterioration? Is it intentional? Joining me now to discuss is Greg Carlstrom. He's a Middle East correspondent for The Economist. Greg, welcome. There's so much emotion around all of this that I want to ask you, if you were to explain to people simply, how did we get here where people are, dying and rioting and they're shooting over access to food? Where did this begin?
I think the short answer is that it began with two choices Israel made earlier this year. The starvation is a direct result of those choices that Israel made. The first was to impose a total blockade on aid entering Gaza between the beginning of March and the end of May. Nothing was allowed to enter the territory. And even since aid has been resumed at the end of May, the quantities are much less than they were last year. The World Food Programme says Gaza needs about 62,000 tons of aid each month in order for people to be well fed. In 4 months, from beginning of March until the end of June, Israel, by its own calculations, allowed in about 57,000 tons of aid, so less than a quarter of what was needed. That's the first part of it. And then the second thing that Israel changed was the distribution model for aid in Gaza. Last year, when the United Nations was in charge of aid distribution, you had dozens of places across Gaza where Palestinians could go and collect food. That's the model that the UN says has worked in conflict zones around the world for decades. What Israel has done with this so-called Gaza Humanitarian Foundation is flip that model on its head. You have 4 points in southern Gaza where Palestinians can go to get food, and that's if they're all operational, which on an average day, they're not all working, so you usually have less than 4 locations. And so you end up with these enormous crowds that we've seen, desperate people overrunning aid sites, trying to get what is a very limited amount of aid. By the Gaza Humanitarian Foundation's own figures, it's handing out less than 1 meal per person per day. So the quantities are insufficient and there aren't many places to pick them up.
Now, what the Israeli government would say is that the reason they have been doing this is that Hamas is stealing all the aid. What do you think is the reality?
Israel has not presented any evidence that Hamas is stealing aid in a systemic way. Now, do I think it's possible that Hamas is diverting some quantity of aid? I think that's plausible because they've been able to feed their men over the past 2 years. So they're obviously obtaining food from somewhere. But Israel has not presented any evidence to substantiate the claim, as some Israeli officials have said, that Hamas is in a systematic fashion diverting aid, making hundreds of millions of dollars in profit from selling it. There's just no proof that it's happening.
What do you make of the Israeli charge that the problem is that the UN is riddled with Hamas, and that is part of the issue?
I think it's very easy for Israel to hold up the UN as a scapegoat here and blame it for this very real problem of starvation in Gaza. We've heard not just that charge that the UN is riddled with Hamas, as you say, but we've heard a lot over the past week, Israeli officials claiming that they are allowing food into Gaza, but the UN isn't distributing that food inside of Gaza. And I think it's a somewhat disingenuous claim because it's not so simple as the UN just sending a driver to the border to pick up a truck of food that Israel has cleared to enter. Anything that the UN does in Gaza has to be coordinated with Israel. If you want to move a truck from the border to a populated area inside of Gaza, the Israeli army has to approve that movement, and it dictates the time and the routes by which that truck is allowed to move. Sometimes it doesn't grant permission, sometimes it does, and then it revokes that permission at the last minute. Sometimes a driver will set out to deliver food, but he'll be stopped at a checkpoint and he'll have to wait for hours until he gets permission to move further. So what should have been a very short journey becomes a long journey. There's this whole military bureaucracy that the UN has to navigate in Gaza. It's a bureaucracy that's run by Israel, and it's a bureaucracy that, at every point, from the moment a truck enters Gaza until the moment a driver sets out to deliver it, that mission can be obstructed.
Is there any talk in Israel about kind of going back to the old model, not creating these 4 choke points, distribution centers, and just flooding the zone with more aid? Would it take American pressure to make that happen?
There has already been a bit of a change in policy, which I think is a tacit admission that this Gaza Humanitarian Foundation has been a failure. But to go further than that, to allow even bigger amounts of aid, I think that would take sustained international pressure, particularly American pressure. And I think it also really requires a ceasefire. The only way to really provide an effective aid operation is for the fighting to stop.
Greg, thank you so much for helping us understand the inside of this problem. Pleasure.
Thank you for having me.
Let's continue this conversation now. With us now is Dr. Amber Alian, as she is the Deputy Program Manager for Palestine at Doctors Without Borders and directly manages the group's operations in Gaza. So good to see you, Doctor. So we just saw that there were more airdrops today. What kind of effect do you think that is having? What kind of impact is it making?
No pun intended, it's a drop in the bucket. There's 2 million people in Gaza, so to drop a few hundred packages doesn't really touch them. And I mean, well, like I said, it doesn't touch the mass need, and it's more of a publicity stunt more than anything.
For those who are on the ground, able to get, to those packages, is there a way you can kind of describe what you have seen in some of the images of people trying to open them, get to them? I mean, just the frenzy of trying to get some of what is, dropping in.
I mean, again, it's over 100 packages. It's not anything to touch. So the people who are going to go there are going to run, and there's going to be stampedes of people trying to rush to get, because the people are rushed to get the supplies because they're desperate. But again, it's nothing like what is waiting on the border for the population from the other aid agencies that are prepared to do this in a more organized fashion, as they've done for decades.
Do you have any hope that any of what is at the borders, those truckloads of food, aid, are ever going to make it in?
I mean, my hope is relying on the U.S. government standing up and saying, actually, our aid to Israel is contingent on the idea that our military aid to Israel is contingent on the idea that you allow humanitarian aid in. And I do feel that the U.S. government is the main government with that kind of position and that kind of leverage. And it's within our own laws, and Israel is not following our own laws. We're not upholding them.
What will it take, do you think, for the U.S. to use that leverage that you describe?
Congressmen and women standing up, and the president standing up and saying, actually, these are signed agreements. This is what we are legally bound to provide this aid. You must do this, or we don't continue to supply you with military aid. We don't continue to fund the war that we've been funding for 2 years.
Another 13 people died from malnutrition in Gaza in just the last 2 days, including children, according to the Palestinian Health Ministry. As a pediatrician, what are your concerns for the children in Gaza, both immediately and long term?
So malnutrition is a medical term. It's a medical state. It's effectively a disease. It needs to be treated accordingly, and there are certain protocols and ways to treat malnutrition when it is at the level of severe acute malnutrition. What we're seeing is like 25% of the population that we're seeing in our clinics are malnourished. And then our numbers of severe acute malnutrition have quadrupled over the last couple of months. So this is really significant in the sense that you have to be able to treat these with proper formulas, proper nutrition supplements, which we don't have access to because we can't get them across the border. And it's problematic not only for the acute term, so these children can die, these pregnant women can die, these elderly people can die, but also long term, there are huge ramifications for children who've suffered from malnutrition.
Dr. Amber Alian, thank you so much for your time. All the best in your continued efforts and the continued efforts of your group to try to offer as much aid and assistance as you can.
Thank you.